Most people with failing teeth are stuck in a cycle of temporary fixes because nobody's given them the full picture of what's actually going on and what a proper solution looks like. If your dentist keeps patching, repairing, and replacing the same teeth over and over again, they're not fixing your problems, they're managing your decline, and nobody's telling you that. In the next few minutes, I'm going to share 5 things that your dentist is simply not telling you about your failing teeth. These are the things I wish everybody knew before they wasted another pound on treatment that just won't last. Whether you've got loose teeth, cracked crowns, or you're just simply tired of being back in the chair every few months, this video will change the way you think about your mouth. You've done everything right, you've gone to your appointments, you've had the crowns, you've had the root canals, you've had the bridges, yet you're spending more money, more time, more stress, and your teeth are still getting worse. That's not your fault. There's probably something going on that nobody's told you yet. My name's Dr. Naresh Hirani, and I've been practicing dentistry for nearly 25 years. And my niche is helping people whose teeth are failing, often after repeated treatments that are simply not working for them. And I've seen this pattern play out thousands of times. I'm going to walk you through 5 things your dentist isn't telling you, and by the end of this video, you'll understand exactly why nothing has worked so far and what actually will. Point 1. Your teeth aren't failing because of bad luck. They're failing because of a pattern that nobody's addressed. Most patients think that teeth fail randomly, whether it's a cracked crown, a failed root canal. In the majority of cases, there's usually an underlying reason, whether it's bite issues, gum disease, or structural weaknesses. And by just having that one tooth treated alone, your dentist is essentially just managing your symptoms, whilst the underlying cause continues to happen in the background. Here's what nobody tells you. Your teeth aren't falling apart one by one. They're falling apart together for the same reason. I just cannot begin to tell you the number of patients that come to me and say, I've spent thousands on my teeth and I just feel like I'm back to square one. That's because they're stuck on a treadmill of reactive dentistry and it's just fix, break, fix, break, fix. And this pattern will just continue until the root cause is identified and managed. Think of it like a house with crap foundations. You can paint the walls, you could change the windows, but until you deal with what's going on underneath, the cracks will keep coming back. And your mouth works in pretty much the same way. If you've had 3 or more major dental treatments in the last 5 years and things are still getting worse, that's your signal. It's not your individual teeth. It's something that's going on underneath them. But even when the root cause is obvious, most patients aren't told about it. And that leads me to my second point. Point 2. Gum disease is probably destroying your mouth right now, and you just would never know it. Gum disease is the #1 cause for tooth loss in adults. It's not cavities, and it's certainly not olive stones. The worrying thing about gum disease is by the time you become aware of it, teeth become loose, wobbly, mobile, or you start getting repeated gum abscesses. At this point, you've lost a lot of jawbone that's holding your teeth together, and this jawbone just doesn't come back. This is the lie that most people believe. My gums don't bleed, so I must be fine. Bleeding is just one sign. You can have advanced gum disease with 0 bleeding and 0 pain. I hold a master's degree in clinical periodontics, which is the study of the gums and the bone that supports the teeth. And I can tell you that the majority of patients I see with failing teeth have undiagnosed or untreated gum disease, which has been quietly eating away at their foundation for years. Imagine a fence post in soft ground. The post may look solid on the outside, however, the soft soil is being washed away. And then one day, very light breeze knocks the fence over, and everybody's surprised. That's exactly what's happening with gum disease. The teeth may look solid on the outside, however, the foundations are wearing away. Ask yourself this. Have you had a full gum assessment with measurements taken around every single tooth? Not just a quick check, but an actual periodontal screening where someone measures the pockets around your gums. If the answer to this is no, or you're not sure, then you haven't had a proper evaluation of the single biggest threat to your teeth. And that connects directly to the third thing your dentist isn't telling you. If gum disease goes unchecked, it not only loosens your teeth, but it limits what can be done to save them. If this is starting to make sense and you're beginning to realize why things haven't been working for you, then hit subscribe. I put out videos every week to help you understand your teeth, your options, so that you don't waste your time and money on solutions that aren't right for you. Point 3, the longer you wait, the fewer the options you're going to have. This one's hard to hear, but it's critical. By delaying a proper assessment by another month, you're losing bone, you're losing tooth structure, and you're essentially losing options. What may be a simple implant case today may become a complex bone grafting case in 12 months. What may be savable today may be unsavable next year. Here's something most people don't realize. Delaying treatment is a decision itself. However, it's usually the most costly one. I see it regularly. A patient comes in and says, I've been thinking about this for 2 years. Now, in that 2 years, they've lost bone, they've lost teeth, and their treatment becomes twice as complex and essentially twice as costly. Now, this isn't their fault. Sadly, they just hadn't been told what is the true cost of delaying treatment. Ask yourself these 3 questions. Number 1, are you avoiding certain foods because of your teeth? Number 2, do you feel like your teeth could go at any time? And number 3, are you avoiding treatment that you know you need, but you're unsure on which direction to go? If you said yes to even one of those questions, then you're in the window where acting now gives you the best options and the most solutions to address your needs. But here's the problem. Even when people are ready to act, they quite often get pushed towards the wrong solution. And that's the 4th thing your dentist may not be telling you. Point 4, dentures are not your only option, and they're really the best solution. Now, I constantly hear this from patients who come to see me for a second opinion. They've been told that their teeth are too far gone, they need to be removed, and they need a full set of dentures. In most cases, this isn't true. Dental implants can be used to replace missing and failing teeth with something that's fixed, stable, and is a long-term solution. With modern digital planning and sedation options, even the most terrified patients can have a comfortable experience having their missing or failing teeth replaced. Let me be blunt, just taking them out, giving them a denture is not a treatment plan, it's giving up. And too many patients accept this because they don't know what else is possible. One of my patients, Anita, she'd been seeing her routine dentist for a number of years. Crowns kept cracking, root canals kept failing, she had multiple abscesses in her mouth. She was embarrassed, she was frustrated. She came to see me and said, Narish, can you help me? I really don't like my teeth. I hate smiling. I constantly cover my mouth every time I smile. This was a real emotional moment for her to open up in such a manner. We digitally planned a full arch implant solution for Anita. We removed her failing teeth, placed implants on the top and bottom jaws. Now, when I fitted her final teeth, before I could show her in the mirror, she had to rush off to the bathroom. And then she came back in a flood of tears. She'd caught a glimpse of her new life and her new smile and was quite understandably overwhelmed. And that's what becomes possible when someone shows you the full picture. If you've been told that dentures are your only option, get a second opinion from a dentist who has expertise in dental implants. Ask specifically about full arch implant solutions and whether digital planning and sedation options are available, because you deserve to know all the options available before you make a permanent decision on your teeth. And that brings me to the 5th and most important thing your dentist isn't telling you, and this one changes everything. Point 5, a proper plan done once will always cost you less than a lifetime of patchwork dentistry. The biggest thing I've learned in 25 years of dentistry is this: doing the right treatment once is almost always cheaper, better, and less stressful than years of patchwork dentistry, temporary fixes, and putting out fires. Patients come to me having spent 10, 15, sometimes even £20,000 over a decade on crowns, bridges, root canals, and repairs. And quite often they're still embarrassed, still in pain, still eating soft foods, and still avoiding photos. The total cost of these temporary fixes quite often exceeds what a comprehensive solution would have cost in the first place. And the emotional cost, well, we just can't put a price on that. Think about it this way: if your car kept breaking down every month and you kept paying for small repairs and fixes, at some point you'd say, stop, this is costing me way too much. Maybe I should just look at getting something more reliable. Your teeth are no different. There comes a point where the smartest decision is to stop patching and start planning. Here's what I want you to do tonight. Get a piece of paper and write down 3 things for me. Number 1, every dental treatment you've had in the last 5 years. Number 2, the cost of this dental treatment. And number 3, be honest. How do you feel about your teeth? If that list is long, the total is high, and your teeth still don't feel right, there you have it. There's your answer. You don't need a repair, you need a plan. Book yourself in for a comprehensive assessment with a dentist who's going to look at the full picture, not just at the tooth that's hurting. Ask for 3D scans, a full gum evaluation, and all your options, not just quick fixes. Your teeth don't have to keep getting worse. You're not too old, you're not too late. However, the longer you wait, your window of opportunity does get smaller. The first step is simply knowing what's actually going on and what's truly possible, and now you do. If this video opened your eyes, the next one goes even deeper. I break down the number 1 reason dental work keeps failing and what you can do about it. That video is on the screen right now. Click on it and I'll see you there.